Hi, everyone. I'm Dr. Pam Peak, host of the Club 100 podcast. Welcome to our next episode. And I got to say, this one is super, super special and close to my heart because it's a friend and a colleague, another physician who many of you have been following through the course of a pretty harrowing journey with his health and the importance of fitness in his life as well as in his recovery. But hold that thought for a minute. What are we all about with Club 100? Well, with this podcast, we talk to women and men who love to lift heavy things mentally, physically, and spiritually. And quite frankly, we inspire as we perspire, as I say with every episode, because it's absolutely true. And we love to be able to share raw, real, authentic stories to be able to help motivate and inspire people with life's challenges, tough times, and triumphs for sure. So this is a shout out to everyone out there. If you want to become a Club 100 member, just run on over to 100 Club 100, have a little look. And if you love it, just put 100 around your title on your Twitter feed and let us know. So there you have it. Oh boy. So today's guest is Dr. Paul Wishmire. And Paul hails from Duke University. I'm going to let you, Paul, tell everyone what you actually do there. We actually share a goodly amount in common, good grief, as physicians and also as fitness crazy people. So, Paul, first of all, I'm just so thrilled, to be able to have a conversation with you after we have been corresponding for so long. I'm not quite sure who followed who to start with or how that whole thing came down. All I know is I glommed onto you because, it's lonely out there as a physician. I mean, it's crazy, but as a physician who's like really into fitness and loves to talk about it, incorporate it, and try to get other people to really take care of themselves. And then I saw you and I went, grab them, because you seem to be a brethren. So, Paul, tell everyone what you do and where you hail from.
Thanks, Pam. It is great to be here with you today, and thanks for having me on. And you're right. I was immediately struck by your passion for it, and how many people you reach, and how many people you inspire with the things you say, and how honestly you inspired me. You really, your words of encouragement through the things I'm going to tell the listeners a little bit about really meant a lot. And so I think it seems like you're doing an amazing amount of good out there. And I'm really thrilled to be able to join you today to talk about it. So as you mentioned, I'm a physician at Duke University. I'm a professor of anesthesiology and surgery in the Duke Medical School here. My primary practice is as a critical care physician. Even though I'm in the anesthesiology department, I only practice critical care, which was always my intent. That's my real passion. And then from there, it gets a little stranger for a typical anesthesiologist. The majority of all my time is spent as the director of the nutrition service here at Duke. And so a lot of my time is spent focused on the nutrition and wellness portions of patients' recovery. And then my research since I was 18 years old, has focused on the role of nutrition and exercise in improving patient outcomes and preparing people for the marathon of their lives, which is often a major operation, or could be recovery from trauma, could be cancer and a bone marrow transplant. But my research and passions really focus around how do we get people ready for these big events, and then once perhaps sadly they've happened or necessarily they've happened, how do we help them recover and get their lives back? And so my research, and the reason I'm in medicine is really essentially to the focus on nutrition and exercise and the role that it plays, and how we can learn from elite athletes and how they overcome and perform incredible feats to help our patients perform the incredible feats they need to as they face the marathon of their lives often.
Awesome. And so, let's go back for a second and then we're going to flash forward to, recent events, as they say in the business. But, have you always been like a fitness kind of guy?
Yeah, so I grew up as a typical high schooler. I played soccer, I played basketball, and I had this picture perfect, really normal childhood until age 15. And I was playing for my high school basketball team over Christmas, and then I got strep throat. And it happens, and I took an antibiotic, and I took erythromycin. And those of you who've taken erythromycin know sometimes the stomach doesn't take it so well, and my stomach didn't take it so well, and but it kept getting worse, and suddenly I was starting to bleed when I would go to the bathroom, and was going 15, 20 times a day and bleeding and bleeding. And if as a 15-year-old, this is nothing you've ever seen. And so my mom took me to the doctor, who scheduled me for this test called a colonoscopy, where they were going to put this scope inside of me, which didn't make a lot of sense to me then. But then when they did it, I realized, oh my God, this is the worst thing you can do to a human being. It was before we sedated people for things like this. And it was really my first experience with medicine. And I realized, one, doctors weren't very nice people, I thought. And two, we weren't seen as people. We were seen as jobs to be done. I mean, they would say, oh, only 2 minutes more, hold still, you're making this harder for me. And I'm thinking to myself, you're not the one going through it. Who's being hard on me? And it doesn't seem like anyone cared. And I think very quickly, I ended up sadly getting admitted to the hospital. I remember they told me, you're going to come into the hospital and you're not going to eat anything for 6 weeks. And then I'm like, the hell I am. I'm going to go play basketball next week, and I'm definitely eating. And they're like, no, we're going to put you on IV nutrition, and you're not going to leave the hospital for 6 weeks. And that was a shock. So it really became apparent quickly. I lost about 60 pounds. I weighed about 95 pounds within a few weeks of that event. Was in the hospital for the better part of almost a year. About 3 months in, had a big GI bleed, got 40 units of blood. And within about a week or two of that event, my large intestine perforated, and I ended up in the operating room emergently having my colon removed, and ended up in an ICU for the first time in my life. And then they told me through this new experimental surgery, I wouldn't have to have an ostomy, and then they would do a few surgeries, and I'd have everything on the inside, and it'd all be great. Unfortunately, what often people aren't told when they have abdominal surgery is the body doesn't ever heal quite the way it was before. And these pouches don't always work so well that I had done. I was the first kid in Chicago to have one done, and the narrow male pelvis made it tough, and mine never really worked well. And I started getting bowel obstructions from the scarring that occurs, which is unfortunately a part of surgery we never tell patients about. We say, we're going to do this operation and make your disease cured, no matter what it may be. But the reality is, many people's experience is they'll eat some nuts, or they'll eat some mushrooms, they'll eat something that maybe they didn't even know they weren't supposed to eat, that doesn't pass. They'll get a bowel obstruction, up in the hospital, maybe even have surgery again. And over the next, about every 8 to 10 years, I would have 3 more surgeries, 2 or 3 more surgeries. So I've had 26 operations now at this point.
Oh, God.
And so this idea that I quickly, it became aware to me that these were major setbacks in life. And I think the moment that nutrition and exercise, especially exercise, became the fundamental tenet of my life and preparation for this, was I was working at the Mayo Clinic doing research with a colorectal surgeon on people who had the illness I had. And I ended up having a bowel obstruction from an apple. And when I was seeing him, he was a big runner. And his name was John Pemberton. He's still operating at the Mayo Clinic, believe it or not. And he said to me, Paul, you're getting a little chubby. You should start running like I do. And I'd never had anyone tell me that in my life. I'd always been pretty fit, but college being what it is, did some things to me I probably didn't need it to do. And I kind of was annoyed with him. I said, well, I'll show him. And I was scheduled to have surgery a year later to have my pouch reversed. But in that year, I started running just to kind of show my surgeon I was in better shape than he thought. And I ran every day for a year. And I came back to surgery, and he told me this was a very high-risk surgery. I had a 70% chance of being sterile and not being able to have kids. And he was in my pelvis. It was super high risk. And my abdomen was like concrete. Didn't even know if he could do the surgery. And so I was supposed to have a 12-hour surgery. I came out of the recovery room 5 hours after the surgery started, woke up, and it was just noon. And I said, gosh, did they even do the surgery? And he came out and he said to me, Paul, I don't know what you've done for the last year, but the abdomen I saw a year ago doesn't look anything like the abdomen I saw today. What I saw today looked like somebody who'd never had surgery in their whole lives. Your abdomen was perfect. So this running thing or whatever it is you're doing, never stop. And so that's when I realized, oh my gosh, this exercise thing probably saved my life and saved my ability to have children and all the complications that may have resulted.
How old were you at that time, Paul?
22.
22 years old. Thank
I was going
God
into medical school.
Thank God it was that early. And, we in exercise medicine know the stats on this. And that is, there are so many levels of increased healing, boosting immune function, anti-inflammatory. I could just go down the list. All the great things that happen when you actually integrate physical activity in your life. So many people are out there saying, oh, I want to get into a size XYZ jeans and, I want to be able to have the biggest bicep. No, wait, stop. This may save your life. This will save your life at some point when you need to have your life saved. And this is a beautiful example of how this works. And also, this was a while ago. And this is even before we had the more illustrious research we have now on the whole intersection of exercise and the healing process and recovery, let alone being proactive and setting yourself up for less intraoperative issues and a better body to be able to be more resilient when it comes to these repeated surgeries. So, wow, what a story. Everyone out there, listen up, life lesson. Okay. There's a lot of reasons you need to be doing this stuff. Okay. Now we got you through age 22. Now what? So what did you do with exercise with all your training and,
Yeah, it really inspired me. And as I went into this is right before medical school. And I went into medical school, lifting weights started to become important, running started to become important. And I got into a running club at the University of Chicago where I went to medical school. There was a group of older guys in their 40s and 50s, one of whom had held the world record in the mile. They were outstanding runners. And they got me into running in the Chicago area racing circuit where I was racing for points at a weight. It was called the Clydesdale circuit. So I had to weigh 185, above 185, between 185 and 200 at every race. And it was 5Ks to marathons. And you got points for where you finished in your weight class. And so I ran 30 races over the next year. I sort of caught the bug, ran a couple marathons, won my weight class one year, and even placed in my age group, which that's because I was young. The older age groups I could have never placed in. It helps to be young. They weren't nearly as competitive, but I really had this passion for it. And I was lifting as part of that because I had to maintain weight, but I probably got into it a little too much. I had run a 3-hour, 19-minute marathon in Minneapolis when I was a second-year medical student. And I thought, gosh, I'm 9 minutes away from qualifying for Boston. And so as a third-year medical student, I was training for this faster race in Chicago. I only needed 9 minutes off. And I thought I was in the best shape of my life. I was going to crush this race. I went out and PR'd my 10K, ran a 1:26 half. So I was running a 2:50 marathon at the halfway point. And then discovered what bonking is. And about 20 miles in, started to cramp my face, my arms, things I didn't know I could cramp, fell on the ground, couldn't move for about 15 minutes, cried a little bit, got up and finished in 3:19 and said, I'm never going to run a marathon again. This is not healthy. This is ridiculous. And so started to lift. I decided I wanted to be bigger and wanted to learn to lift. University of Chicago did not have air conditioning in their gym at the time. So I said, well, maybe if I sell myself as a personal trainer, I can get into a gym and exercise for free in an air-conditioned gym. So I ended up finding a job at a world gym, a big bodybuilders gym, where Sergio Olivia, Miss Olympia, had beaten Arnold. He was the head personal trainer. So he taught me how to be a personal trainer from the eyes of a professional bodybuilder, including some of the drugs and some of all the other things that go into the extreme fitness levels and muscles these guys achieve. And so he taught me how to lift right and how to eat right. And the other trainers in the gym, all of them were professional bodybuilders too. And so I learned more about nutrition and exercise as a personal trainer in medical school than anything in medical school, of course, ever teaches us, because we know 75% of medical schools don't teach any nutrition at all. And they definitely don't teach any kind of exercise science.
Well, I'm going to stop you there for 1 second because I want everyone to hear that. That was then, and you were still in training at the time, in medical training.
I was a third and fourth year medical student.
Right. How many years ago ish was that? Ish?
So 95, 96, it would have been what? 30 years ago.
Yeah, about 30 years ago. Okay. So I felt the same frustration when I was in medical school. Not one moment, not one iota about nutrition. And, I bet you and I could commiserate when I finally hit the ICU. And I'm like, well, I'm supposed to keep these people alive, right? And one of the most important things is knowing nutrition. Oh, the subject I was never taught. So I became one with the registered dietitians who hung out in the ICU. I just literally was learning from, at their knee and just like, how do you put together total parenteral nutrition? How do you, do this GI feeding and all the rest of it? And I got so frustrated that, flash forward a little further down the line after practicing this for a while, I actually went back in academia and became a Pew Foundation scholar in nutrition and metabolism, went back to the University of California where I came from, and did that because I was going to be damned if I didn't know the academics behind this. And this is ridiculous. And I just sort of stamped my foot down saying, why the hell don't medical schools, nursing schools, all the rest of them teach this stuff? This is ridiculous. Okay, I'm going to get right now off my soapbox because when you said that, it triggered me. So that's another reason why I really glommed onto you, because it's like another brethren who gets it with the nutrition, but it's a physician too. So that's cool. So then you were training in this gym while you were in medical training. And you really started understanding what this whole weight training was about. How did you take to it? Did you love it or what?
Loved it. I gained 60 pounds over the next year.
Oh, all right. Okay.
And I was not using any drugs, although I was blown away by the pharmacologic knowledge of the people in those gyms and the physicians that worked with them. And it was unbelievable. I was not doing that, but it was fascinating because at that time I was spending a lot of time as I moved into my residency. Actually, I did a year of pediatrics in Colorado, but then came back to University of Chicago to do anesthesia and critical care, and was working in a burn unit, a kids and adult burn unit there. And we use a lot of anabolic steroids in our burn patients. It's used around the world. If you're in South Africa, India, or the US, you're going to get oxandrolone, which is a drug that was developed and used a lot by bodybuilders, but now we use routinely in burn units. And other anticatabolic and other agents is very common in my burn care. And so it really brought together sort of the knowledge that I had gained as an athlete in the gym, learning from these professionals, to how you use that to improve patient care and give patients their lives back. And so as I moved into my residency, I really was more of a bodybuilder power lifter who did a little cardio on the side. But that's when my research really became a bigger part of my life. I started doing clinical trials of glutamine. Glutamine, the amino acid, became a huge part of my life for about the next 20 years. And so I was studying the roles of amino acids and protein in preventing infection, in improving recovery, in getting people out of the ICU sooner. A lot of different research, both at use in TPN and given orally and enterally to patients. And then I did a lot of laboratory work looking at how amino acids signal genes for things like heat shock proteins and other protective proteins. There's some really basic transcription work that I did with the NIH.
And you just kept working out the whole time.
I did. I was lifting. I was probably weighed about 240 then, and had about a 620 pound deadlift, about a 620 pound squat. My arms are too long to be a great bench presser. I could never get much above 365.
How tall are you?
I'm about 6'1".
Okay, so I'm good with that. Do you mind very much if I ask? I mean, you don't have to answer.
Sure.
But how old are you now?
I'm 52.
52. That's wild. Awesome. 50 plus. All right. Just, heads up, everyone out there, never give up. So you kept the fitness going all throughout this whole thing, and yet you were still coming back to the issue of your inflammatory bowel disease. It would sort of flare up every now and then.
So, and it wasn't even actually the IBD flaring up because my colon was gone. So the ulcerative colitis was theoretically cured, but the adhesions and the bowel obstructions continued to happen, right? I would discover some new food that would obstruct me that I couldn't eat anymore. And ultimately, I would have 2 or 3 of these a year. Like in college, I'd eat some baby carrots and they would, they don't digest very well and they'd block me up and I'd end up in the emergency room for a couple of days or the hospital. And this sort of just kept happening. But I always could usually work around it until 2003, when I finished fellowship and I moved to University of Colorado to take my first academic job. I had about 6 obstructions in about a 9-month period, and they were happening right at my stoma. And there was a surgeon there, an old-time surgeon, Nathan Perlman, old-time cancer surgeon, who said, we got to fix this stoma. It was ironic. They tried to dilate it. So my chair would come in after I worked in the OR during the day, and he would sedate me with some propofol off the books. And they would do these dilations. I mean, it's doctors probably shouldn't take care of their friends, and your friend shouldn't be your doctor. But it seemed like a good idea at the time to avoid an operation. But we were all probably pushing some lines.
Tell everyone what a stoma is for
Sure.
people who are not medical.
Yeah. So when you see people that have ostomy bags or ostomy pouches, you may have a grandparent or a friend that has those. They bring your intestine out through your skin and they turn it inside out, a little bit like a sock getting turned inside out. And they sew that down, and all of your stool and all of the output from the food you eat, instead of coming out from your rectum, comes out into a pouch. A pouch, there's a wax wafer that sticks to your skin, and then a pouch that clips on or clamps onto there. And so that's how you use the bathroom for the rest of your life. And the stoma it travels through the abdominal wall and sits right at the skin like there. And in my case, it had become really narrow and tight right at the abdominal wall. It's about as big as my thumb is about how big they look. And they look like a little rose bud is how they look in color. They're bright red. There's a lot of blood vessels in them. And so ultimately, mine had to go. And so this surgeon tried to do a small operation to bring up a new piece of bowel to create a new stoma, hoping that would solve the problem. It seemed to for about 3 days, but then I finally went home from the hospital after a couple of days, and it started to bleed, and it bled a lot. And I nearly bled to death at home. It was terrifying. I bled down to hemoglobin of 3, and normal is more like 12 to 14 to 16. So I lost a massive amount of blood and was rushed back to the hospital. And the surgeon came out. He was very frustrated because he was a colleague. And he said, "Look, Paul, I can't stop the bleeding. You're going to die. I don't know how to fix this," which was nothing you ever want to hear from a surgeon you respect.
No, that's a bad thing. Yeah.
That was a bad thing to hear. And it really was terrifying. And it really shook my world, because I kind of thought if I did everything right and ate right and exercised right, this kind of stuff wouldn't happen to me anymore. But the reality is, of course, none of us are totally in control of what happens to us. And clearly, it is essential for recovery and allowing the surgeon to be able to operate on me, but these things still happen. And that was really shaking for me. He ended up going in, opening my abdomen, and found the distal 8 or 10 centimeters was really necrotic and injured from all the obstructions, and the rest of the bowel was fine. And so they were able to bring up another piece, and then it was able to work out. But it was really kind of a shock. And, I'd been, another thing that challenged that part of my life was I had been on painkillers for about a year because of all the obstructions I was having. And this was really shaking. And I had a really hard time getting off of them. And I think that's another thing all of us in the country today are struggling with. And I think physicians especially are hesitant to talk about the challenges they have with it. And I ultimately voluntarily went to rehab for that. And I think it's something I wish we as a physician community and maybe as a national community talked more about. It saved my life. I mean, even as an anesthesiologist in clinical pharmacology, I did a clinical pharmacology fellowship. I didn't know how to come off of these drugs, and I needed help. And I really think it was one of the best choices I ever made. And I've watched plenty of colleagues die because they don't make that choice. It's the number one killer of anesthesiologists under the age of 40.
Okay, say that one more time.
Opiate and drug addiction in general is the number one cause of death in anesthesiologists under the age of 40.
That's just totally crazy. And I don't think people understand that. I mean, wow, that is just huge. Yeah. Jeez. And, I'm going to stop here for just a second. Paul, have you ever just had a poor pity me party? Like, holy God, you've got people out there who break a nail and it's the end of the freaking world. And then you hear a lot of what my trademark phrase is BMW, bitch, moan, and whine. It's like, oh, life is hard, and oh, my leg won't really do it with the quads today and the gym. Like, shut up. That's one of the reasons why I have you on, because I know for a natural fact a lot of your history, because I've obviously been following you. But dear God, here you are. And how did you become, as it were, so resilient?
Yeah, going back to my first experience with physicians and medicine in general, I think I realized, I feel like physicians aren't really taught to care for patients. They're taught to do procedures, and they're taught to go through checklists and do physical exam checks. And I said to myself, I think I can teach people to do this better. And maybe the reason I've been sick is I'm supposed to go into a career in a field that I can teach physicians to be better physicians. And moreover, I can do research and maybe find better ways to treat disease where the treatment isn't worse than the illness, right? The thing I got from IBD was steroids. Prednisone. They made me crazy. They gave me stretch marks, and I never went into remission. They never made me better. And so I said, somebody should study treatments, which is ultimately how I ended up in nutrition and exercise, that aren't worse than the disease themselves, don't have more side effects than the illness they're trying to treat, and actually really give people a lifelong chance to get their lives back and to recover. And so I think I always believed that everything that was happening was for a reason, and that I was needing to learn from it so that I could share that experience with others, and perhaps not only help patients is what I hope it helps, but also help other physicians learn there's other ways to do this, and that caring is the most important part. Like when we do rounds and stuff, I used to do a whole set of teaching around body language and how to make a patient feel comfortable with your presence, and to cross the midline of the room, and to face your feet towards them, and to get low to the ground, because it's terrifying to have a bunch of white coats staring down at you in the bed. And so I think I always felt like this was all happening for a reason, and everything that happened was something else I integrated into things I would teach the next generations of physicians, and even teach patients. I mean, patients, like you said, don't realize that if they exercise when they have cancer, the tumor shrinks faster than the chemotherapy actually shrinks the tumor. And that if they exercise before their operation, they're likely to have an infinitely better outcome afterwards. And if they take simple protein drinks, their infection risk goes down 50%. It's basic.
Well, it's this whole attitude that got me really following you in a big way, especially when you posted this one particular thing that just went viral. And it's called Advice from a Patient. I'm going to read it.
Yeah.
This may be a normal day at work for you, talking about the physician, for you, but it's a big day in my life. The look on your face and the tone of your voice can change my entire view of the world. Remember, I'm not usually this needy or scared. I'm here because I trust you. Help me stay confident. I may look like I'm out of it, but I can hear your conversations. I'm not used to being naked around strangers. Keep that in mind. I'm important because I want to get the heck out of here. Okay? Nothing personal. I don't speak your language well. Don't speak your language well. You're going to do what to my what? I may only be here for 4 days, but I'll remember you the rest of my life. Your patients need your patience. Okay, so yeah, I'm like all over that one. And everything that you just said about your whole philosophy, your attitude, and all the rest of it is absolutely grounded in what that one tweet was all about. And I was reading the comments, of course, one was mine, and we were just whoa, because what it is a little slap in your face as a provider to remind you that you could be on the other end of this any day now, any moment, number one. And number two, to do like you're doing now, Paul, because of your own experience on so many levels as a human being, as a provider, all the rest of it, that, you have to stay mindful of all of this and to be respectful at all times. And we as providers, sometimes you forget, you're just running around in gerbil wheels. And this is like a slap in the head. So I actually made a copy of that and I keep it on my desk because I love it so much. So can we do this? Flash forward now to what happened this spring, because I shared so many of your posts when you had this latest crisis. I shared your posts with everybody because it was all about, can I make it through? And then the role of fitness, mind and body in your recovery. Go for it.
Yeah. So sort of after we left the story off, I did really well after 2003 for about 10 years. And then I'm going to compare and contrast something that happened in 2014 to what happened this spring. So in 2014, again, the obstructions started coming back, and I had quite an emergent one occur where I ended up in my own emergency room at University of Colorado with a lactate of about 10, a really high acid built up in my blood, and was emergently rushed to the operating room by my own surgeons, the same Dr. Perlman and others, including a new surgeon who I had as a resident, which was crazy. And was in the hospital for 23 days on TPN. And I was writing my own TPN at this point, right? Because I'm the director of the nutrition service. But didn't really have any guidance about how many calories I needed or anything else. And during that time, despite that, I lost 45 pounds, became incredibly weak. And I was hospitalized about 21 days in 2014. And it took me about 2 years to fully recover. And I'm going to tell you that I used to think that was just a necessary part of anyone having surgery, that you got weak, you lost muscle, all this stuff happened no matter what you did, and then you just had to work hard to recover on the other side. Well, I'm going to tell you that isn't necessarily true. And I learned some things recently that taught me I did it wrong, and we can do better. And so after that, because of the emergent nature of the surgery, they had wanted to get my gallbladder out, but they didn't. And they left this inflammatory mass around my gallbladder in because they had been operating for too long. I started to get recurrent obstructions and gallbladder issues from that, but nobody said I should ever have surgery again because I was on the edge of being short-gut, not having enough intestine to live independently without fluids or TPN, IV nutrition. And so the idea of avoiding surgery was number one. And so about every 6-8 months, I'd have an obstruction, but we'd get through it. But the problem was now I would also get a kidney obstruction. My ureter was adhesed to my bowel, and it would get blocked too, and I would get terrible kidney injury every time I got a bowel obstruction. Now it was starting to threaten my liver and my kidneys and other things. And so finally, my obstructions multiplied enough that they were happening pretty frequently. And then in February, my wife and I went to Hawaii to go surfing, which we do often. And we have a good friend who's a trauma surgeon there who we trained in Colorado. And after a day of surfing, I don't know what I ate, an acai bowl that I don't understand why that would have been a problem, but I was playing in the water in Waimea Bay and in the waves and started to get this really bad belly pain. Ended up with a bowel obstruction there, went to an outside hospital there, and it was terrifying. All kinds of strange things happened. Because of COVID, they wouldn't let my wife in, who's also an ICU physician assistant, well-versed in medicine. And I'm a terrible patient. I'm really bad at advocating for myself. I'm really bad at being a patient, and I really need family, and as all our patients do. And man, they nearly operated on me. They gave me some drugs I should have never gotten. They never dealt with a patient like me in that setting at this small hospital. And we realized, holy cow, this could happen when we're out of the country. This could happen when we're out of the state. This can't happen. I had to make a choice to say I need to have an elective operation, even though there's no business I have having one, to get this dealt with, because I can't live my life in fear that at some point this disease is going to suddenly take my life, because we're out of the state of North Carolina and away from, there's an outstanding bowel transplant surgeon here named Deb Sudan, who is my trusted person. She's one of the best in the world, and people like me. And so on April 20th, we set a date for me to have a big operation to go after this obstruction that was, you could see it on CT scan where my gallbladder was. And so I started getting ready, right? I started doing the things that I always do. I never know what day I'm having surgery. It may be tomorrow, it may be the day after tomorrow. And so I'm always doing these things, but I did all the typical preparations. There's a set of supplements called immune nutrition that have arginine in them that helps support the immune system through surgery. We know that reduces infection by about 50%, even in well-nourished patients. So like when my mom had heart surgery, she took it. If I had a 10-year-old, if one of my kids was having surgery, I'd have them take it. I did all the things and got ready with all the supplements. I take a list of supplements. It's about 15 things long, all of which have science to them. And I'm always happy to share them. And the day of surgery, I really thought I'm really ready. And I'm scared, but I'm really ready. And I went in, it was a 13-hour surgery. She ended up taking 20 centimeters of bowel and my gallbladder. So now I'm theoretically shortcut, which is a bummer, but I've been doing okay. And I woke up and felt pretty good. And literally the next day I was walking around.
We saw the pictures.
Yeah, the ICU I work in, no less.
I was like, damn, yeah. Paul, you know, I mean, didn't you just have like a 13-hour surgery? Like, yeah. Why are you out of bed?
You got to get up. You got to get up. Walking is life. And it's the only thing that really keeps those complications down and gets you out of the hospital. And so 12 hours after that big surgery, I'm up walking and I thought, okay, I'm going to get past this. She said the surgery went well. I don't think there were issues. Unfortunately, about 3 days later, in the middle of the night, I suddenly woke up sweating with a fever and stool pouring from the incision in my abdomen, just nasty fluid just pouring out of my incision. And so my bowel had perforated. I'd gotten a hole somewhere. I'd evolved a hole, perhaps because of the things that happened in the operation. It was a tough operation, and I got very sick and was rushed back to the OR. And I was brought back.
We followed that as well on your tweets. Yeah, so it was very scary.
It was terrifying. And I have vivid memories of being intubated. And I remember I was like watching myself. I thought I was the one caring for someone else, looking at myself. It was a very strange,
it's very out of body,
a lot of delirium. Yeah, it was a very strange experience. And finally got extubated. And then 2 days later, it leaked again. Had to get rushed back to the OR again. And I thought to myself, oh my gosh, this is devastating. They said, look, we can't fix the holes. The sutures aren't holding. You're going to have this fistula for a long time. And that was the greatest fear I had, because I take care of a lot of unfortunate patients who have these fistulas sometimes for years. It's devastating. And we fight for them and do all kinds of nutritional things for them. And some of them they're really hard to ever heal. I have lots of surgeries and sometimes they're in the hospital for a year. And I thought, oh my God, this is going to destroy my life. And so the surgeon said, look, you're not going to eat for 2 months. Something I'd heard before, but this time I had a little better sense of it. And we're going to send you home on TPN if we can get you home. And you're going to have to be antibiotics for weeks. And we hope it closes. And if it doesn't, we're going to have to go try to operate again in 3 months. And I thought, Jesus, this is exactly the thing I feared would destroy my life. And it's hard sometimes to work in the hospital and watch patients go through what may be the sort of the path you're going to take, because this is who I care for largely, and a lot of us do. So I went home, was on TPN at home, had a
TPN. I want to make sure everyone understands.
IV nutrition,
you have to have a little, you have to have a big ass, needle kind of situation going into. There you go. And then you have a little line there that you probably saw it if you go to his Twitter feed, which is at Paul_Wishmire, which is WISCHMEYER. You can see that on his name right here. And he had to live with that. And so he's getting his nutrients right into his circulation for all intent and purposes. And he had to stay that way for quite some time. And we all followed you, but then you started doing something kind of wild. It was enough that you were up and already kind of walking around there. But then once you finally came home, and we all celebrated you got home, which is great because hospitals are not the neatest places to want to hang out. You started exercising. What the hell? And so tell us what was going on.
Yeah. I actually even started in the hospital. I had a really great occupational therapist who brought me some exercise bands. They're just the stretchy bands. And I started doing those in the hospital. Actually, even before that second emergent surgery, I had already started because I knew I had to keep it going, because I thought to myself, maybe I don't have to lose weight. Maybe I don't have to lose muscle. And The other thing we did was I worked with a group in Europe, and we designed with an industry a new metabolic cart, indirect calometry. It's a device that measures how many calories you need for your body's specific muscle mass and metabolic needs. It basically measures how many calories you need. And the devices that used to exist were inaccurate. They were impossible to use. They cost a fortune. They were giant, and nobody could ever really make them work. So we said we need to solve this problem. And so over the last few years, we built a new device that calibrates in minutes. A dietitian can use it. Anyone can use it. And it measures in just a few minutes, and it's highly accurate. So before I had surgery, and then in the days after my surgery, each day they would come put me in a hood, and they would measure my metabolic need. And so we discovered my resting metabolic rate is 3,000 calories a day. And that's if I never got out of bed. That's how many calories I burned just laying down. And then you have to account for any movement or exercise you do. And so we discovered I needed 4,000 calories a day, which is an enormous amount, more than I would ever give a normal patient. But everybody's different. And that's, I think, a major advance we've made in the last year is now we can personalize nutrition and we can target exercise. I also did a step test. It's like a CPAT test we do in Olympic athletes to see what my heart rate target should be in my exercising. We do this for patients after COVID in a study that NIH funded. And so we have begun to really bring science to exercise and to nutrition for patients. And so I was using that data to help guide my own nutrition and exercise. And the most I lost through all this sepsis and shock and all these things was 10 pounds.
That's crazy.
And 40.
And yeah, because well, you and I are old school, and we're used to seeing people just melt away. And there had to be a different way to do this. The good news is we do have new tools today. I use the hood. We always called it's a girl in the hood. That's this big, huge hood that goes over you when you do something called indirect calorimetry. And that is really measuring the total number of calories needed to be able to sustain survival for all intent and purposes. We did this a lot in the burn unit, obviously, and the ICU is very, very important. But, when we were all, observing this, Paul, and I kept sharing all of your journey with Club 100 and everyone else, and they were all cheering you on.
Nice, yeah.
One of the things that I think everyone was really impressed with was the fact that, you defied the odds. And you did it by using really great science, which is obviously the way we like to roll. And really, to be able to show that you have other options. You don't have to just sit there, melt away, and become super unhealthy, that we have new ways to do this. And you and your team over there, using you as an N of one, had a wonderful time literally using you as a model for how to apply all of this. Now, let's flash forward to today, right now.
Yep.
How are you? What's going on? Are you back to your usual work? What's happening? Because I'm looking at your Twitter feed and it's all medical again. And so what's been going on? Because I know the Club 100 members are like, all right, give us a status report.
Yep. Yeah. So as you saw some in those earlier posts, I got some really good advice about the exercises I could do, right? So my surgeon said, you can't lift more than 10 pounds because if you get a hernia or blow out that incision, I'm gonna kill you. And so I said, okay, what can I begin to do that minimizes the risk to my incision? This is what patients ask me all the time. And I think surgeons get asked this all the time. And so I learned to use those exercise bands. I learned to use light weights. The Peloton and those kinds of exercise devices are a lifesaver. I never knew how amazing the Peloton was till I got it for my wife. She loves to bike, and I end up using it more. Those are amazing devices, and I don't work for Peloton, and they're not giving me money to say this, but I could do that within a day of coming home. And I had a drain in my abdomen. I had this big drain because it had to drain that fistula. And I had an open incision in the middle. I had this big open incision and the TPN line and all the things. But, those things don't impede you from being able to do basic lifting exercises and cardiovascular work on a bike and even on a stair stepper probably, but on a bike for sure. And so I immediately started doing that and tried to do it every day. Got all the nutrition I needed from the TPN, obviously. So I was getting what I needed, even though I couldn't eat. And I would go see my surgeon every week. I had a CT scan every week for about 6 weeks in a row. So I'm going to glow in the dark for the next year. And the fistula and the drain output started to go down, and the fistula closed. And thankfully, the leak went away. And about 2-3 weeks ago, she pulled the drain out. And we all prayed that it wouldn't recur, because that would have been surgery in this next few months. And it hasn't come back. And I regained all the weight, that about the 10 pounds that I lost within a month on TPN, even before I was eating. And then as the TPN began to wean and she got closer to pulling the drain, she let me start eating. And it was slow. First it was liquids, then it was soft solids. And so I had to slowly start reintroducing foods. And now I'm able to eat whatever I want, pretty much. There's certain things I still avoid, obviously. And I've gained all the weight back. I'm probably about 80% of the strength I was before. Creatine makes a huge difference. I don't take creatine rarely because I'm plenty big, but creatine has got a world of research around it, and I always use it after surgery, and I'm taking it now. I add glutamine back. I really focus on some additional strength building nutrients, and then I do a lot of hit lifting, a lot of
high intensity
interval lifting, where you lift in intervals, and that's great for lighter weights as I get my abdominal integrity back. And like yesterday, I started actually doing like real bicycles and real like abdominal rotation exercises in the last week. And I'm dancing again. I don't know if some of you may have seen.
Yeah, I saw the tango. We're and your wife.
Dancers. Yeah, and we do a lot of overhead lifts. And that was 8 weeks after surgery. As soon as the surgeon said you can lift, we started doing lifts and dance again to see if I could do it. And I could. And we're competing next weekend, actually, in a competition.
Get that up on Twitter. Come on now. Get that up on Twitter. I want to see.
Yeah, there's a competition here. We're doing 2 tango dance showcases with a lot of lifts in them, a lot of overhead lifts. And I've been able to do it. So the strength is there, and the core is there. And I would have never imagined in April, when I was sitting in the ICU intubated with peritonitis and thinking, oh my God, this has been in my life, that I would be dancing in a competition 3 months later.
So let's now sort of summarize some of this. One, we're talking to an extraordinary kind of guy. And by the grace of God, somewhere along the line, you just turned into a resilient human being. I can tell you that with a journey like this, you and I have seen patients who feel helpless, hopeless, and defeated. And they feel terrible. And it's our job to try to lift them up and to show them that they got what it takes. But, here you are, a physician, a critical care specialist, an expert in all things nutrition and metabolism. And, you went through the whole thing, because now you're on the other side of it. And you had a chance to be able to take the entire experience and all the lessons and really apply them to yourself, and then further enhance by proving the concept that you don't have to melt away, that actually if you maintain a fundamental, strong, profound foundation of fitness, that, your body will reward you somewhere along the line when you need it with a much more powerful ability to sustain whatever just happened and then recover from it. And that's something most people never make a connection with. And this is one of the most powerful lessons of this entire interview and discussion is that, think of all the things that fitness does. And, really stop and pause and say, wow, this is a practice that I'm going to have for the rest of my life. It's a ritual, a routine. It's not a should I, coulda, woulda, No, shut up and just do it. Take our word for it. You got 2 physicians here. Look at us. Okay. Very compassionate here. And we're telling you that this is one of the most important things you could do to save your own life. And then you've got all the other rewards. You look better, you feel better, you're stronger, blah, 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 and all the rest of it. And then you could do things like the tango. You could do things like have a lot of fun, in sports and, hop on that surfboard and do all those things because your body and your mind are there for you. So, I'm plucking all of these beautiful life lessons from this, and showing the critical role that fitness plays in our lives, and you're just such a perfect example of this. And I can just tell you that you've blown the mind of so many club members who have been following your journey and just can't believe it. Like, you got out of this. I mean, this, how? And then you're sitting there doing your exercises, and absolutely. And we're like, well, wait a minute. And you look absolutely fantastic despite the hell you've been through. And I still haven't heard any poor pity me party. Like, oh, woe is me, and I can't believe this. No, it's sort of like, well, got to get around it, and we got to keep plucking along and keep learning and applying and getting better. Does all that make sense? Did I miss any life lesson there?
I think that's perfect. I mean, I think you're absolutely right. And I think, I had always thought when I was young that I would go into taking care of the same patients that had the illness as I did. I thought I may go into gastroenterology. And I realized I couldn't do that because, like you said, unfortunately, sadly, so many people with chronic illnesses or really disastrous events become victims of their disease. And they just give up. So even when physically or medically they're improved, they just say, oh, I can't do it. I just can't keep going. I don't believe I'm actually going to be better. And I really had a hard time taking care of patients like that because I would say to them, I'd say, no, you can beat this. You can get your life back. You can do anything you want. And it was hard. They looked at me and were angry at me because I was well. And I was frustrated with them because they didn't believe that they could be better too. And I realized, especially it was really challenging. And you're right. I've found some people and it's tough. And I know, and there's days I want to give up too. I can tell you in May and June when I thought, oh God, this fistula's never going to heal. There were days I'm like, oh my God, this is, but you know what?
But you're a human being. You're a human being,
right? Life is too short, and you've got to. And I've found that when I fight, I believe I'm going to get better. Every day I would feel that way. I would say, okay, I'm going to go exercise because when I know when I'm done, I'm going to feel better and realize I'm taking another step.
Listen to that word. Listen to the word that Paul kept using, believe. Okay. Yeah. It's really interesting. I keep saying this, but someone I followed for years, eons ago, was Flo Jo, the Olympic sprinter. And she was amazing, needless to say. And she had a motto that she taught her daughter and anyone who come within 100 feet of her. And it was just 3 words. And it was believe, because you can't get off first base unless you truly believe you can. So there's like a deep resonating belief. Believe, achieve, succeed. Those 3 words, and that's the way it rolls. Without belief, you can't achieve. And if you don't achieve, you'll never succeed. And so that was just somehow imprinted on my brain. I don't know why, but it just really worked for me, like in a big way. And so that's one of the reasons why I just wanted to kind of run that by you, that the word believe is so powerful. So, all I can say, Paul, is that we're all honored. And of course, I'm beyond delighted to hang out with a kindred spirit and a colleague for your sharing all of this, because there are so many, it's just rich with life lessons. I'm sure people are going to be listening to it and re-listening to it and back and forth to learn even more. But Paul, thank you so, so much for everything that you shared with us. Your words of wisdom really, really resonate. Seriously. Thank you, Paul.
Yeah. If I just 2 last things that my 3 things that I've always lived by are the 3 P's: the passion, purpose, and perseverance.
Oh, I love it. Passion, purpose, and perseverance. Okay, the 3 Ps. I'm going to imprint that one too. I'll have all kinds of things. It'll be like a memory test as I get older. Do you remember what Paul said?
Yeah.
There it
And
is.
the last thing I can't say thank you enough to Pam, to you, and to all the people on Twitter and on Instagram and on all the social media feeds, all the people that said incredibly inspirational and supportive things that, would really just change my whole outlook on a day. Well, while I was in the hospital, while I was after the hospital, I can't even express to you how meaningful it is when you reach out, especially to someone you barely even know, and say some of the amazingly supportive and inspirational things that I have heard. And Pam, you were definitely amongst the leaders of saying things that really meant so much, and sending flowers, and people sent things from all over the world that just it was so inspirational to me and would really just pick me up when I was down. And the second thing I'll say is I can't express enough gratitude for the physicians, nurses, physical therapists, respiratory therapists, APPs, and my surgical team at Duke, who just went to the mat and did just amazing work for me. And I will never forget how they cared for me, and the incredible love, compassion, and care they showed. We rarely get to say that to our caregivers, and I think we as caregivers rarely get to hear that from our patients. And so I really always want to take that chance to express that. And I'm so glad you read that patient experience.
Oh no, that is.
Yeah, I encourage all of you to read that. Maybe I'll pin that on my Twitter page so it's at the top.
I think you should. If you see the pin on my Twitter feed, it's that one about self-care for providers, because we're the last ones on our own radar screen. And then it's like, oh, that's right, I have to take care of myself before I take care of others. Just a thought. And that's why, I think I resonated so well with that, because it's all about that. So, Paul, thank you for everything you did. And, for everyone else out there, that wraps up another incredible episode of the Club 100 podcast. Just run on over to @100 Club 100 and also check out all the other podcasts. I just posted another one today. It's stories like this. Every one of the members is just like, oh my God, the stories just rattle your cage. Like resilience and regrouping and resetting. It's just amazing. And also the integral place that mind and body fitness play in people's lives. So I just want to leave it with that. And please run on over to Paul's page, because he's going to put that little, note up there as his pinned tweet. And honestly, all I can say is I'm Dr. Pam Peak, and I am the host, very, very proud host of the Club 100 podcast, where it is an absolute pleasure and an honor to interview and hang out with some of the coolest people around. Paul, you're definitely up there.
Thank you.
Take care, everyone.
Take care.